Hello and welcome. Today, we're diving deep into a common yet often misunderstood lung disease as chronic bronchitis. We'll explore its causes, effects, how it's diagnosed, and what you can do to manage or even prevent it. So, let's breathe in and get started. Chronic bronchitis, at its core, is typically caused by long-term irritation and inflammation of the bronchial tubes. The most significant culprit, cigarette smoking, exposure to other irritants like air pollution, dust, and chemical fumes in the workplace can also contribute, especially with prolonged exposure. In rarer cases, genetic factors might play a role, making some individuals more susceptible than others. Recurring acute bronchitis infections may also increase the risk of developing chronic bronchitis. Now, let's understand what happens inside the lungs. When the bronchial tubes are constantly irritated, they become inflamed. This inflammation leads to several changes. The lining of the tubes thickens, producing excessive mucus. Simultaneously, the cilia, tiny hair-like structures that normally sweep mucus and debris out of the airways, become damaged and less effective. This combination of increased mucus production and impaired clearance leads to the characteristic cough and shortness of breath associated with chronic bronchitis. Over time, the airways can become scarred and narrowed, further restricting airflow. Chronic bronchitis is a significant health concern globally, with varying prevalence rates depending on factors like smoking habits, air quality, and access to healthcare. It is a major component of chronic obstructive pulmonary disease, or COPD. It's estimated that millions of people worldwide are affected. While it can occur at any age, it's most common in middle-aged and older adults, particularly those with a history of smoking. Its impact on quality of life and healthcare systems is substantial, making understanding and management crucial. The hallmark symptom of chronic bronchitis is a persistent cough that produces mucus, often referred to as a smoker's cough. To be diagnosed with chronic bronchitis, this cough must be present for at least 3 months of the year for 2 consecutive years. Other common symptoms include shortness of breath, wheezing, chest tightness, and fatigue. Some individuals may also experience frequent respiratory infections. The severity of these symptoms can vary from day to day and can worsen during cold weather or when exposed to irritants. Diagnosing chronic bronchitis typically involves a combination of medical history, physical examination, and diagnostic tests. Your doctor will ask about your smoking history, exposure to irritants, and the duration and characteristics of your cough. A physical exam will include listening to your lungs for wheezing or other abnormal sounds. Pulmonary function tests, such as spirometry, measure how much air you can inhale and exhale and how quickly you can blow air out. These tests help assess the severity of airflow obstruction. A chest X-ray may be performed to rule out other conditions, like pneumonia or lung cancer. In some cases, a CT scan of the chest may be necessary to get a more detailed view of the lungs. While there aren't distinct types of chronic bronchitis in the same way as, say, different types of pneumonia, it's helpful to think about the severity. Some individuals may experience mild symptoms with occasional flare-ups, while others may have more severe, debilitating symptoms that significantly impact their daily life. The severity is often graded based on the frequency and intensity of symptoms, as well as the degree of airflow obstruction measured by pulmonary function tests. The treatment for chronic bronchitis focuses on relieving symptoms, preventing complications, and slowing the progression of the disease. Quitting smoking is the single most important step. Medications often prescribed include bronchodilators, which help to open up the airways, and inhaled corticosteroids, which reduce inflammation. Mucolytics may be used to thin the mucus, making it easier to cough up. Pulmonary rehabilitation programs can teach breathing techniques and exercises to improve lung function and overall fitness. Oxygen therapy may be necessary for individuals with severe disease to help increase blood oxygen levels. In severe cases, surgery is almost never used to treat chronic bronchitis directly. The best way to prevent chronic bronchitis is to avoid smoking and exposure to other lung irritants. If you smoke, quitting is paramount. Avoid exposure to air pollution, dust, and chemical fumes whenever possible. Wear a mask in environments with high levels of air pollution or workplace irritants. Get vaccinated against influenza and pneumonia to reduce the risk of respiratory infections. Practicing good hygiene, like frequent hand washing, can also help prevent infections that can exacerbate chronic bronchitis. The prognosis for chronic bronchitis varies depending on the severity of the disease and individual factors, such as smoking history and overall health. While there's no cure for chronic bronchitis, the symptoms can often be managed effectively with treatment. Quitting smoking is the most important factor in slowing the progression of the disease and improving long-term outcomes. Recent research has focused on developing new medications to reduce inflammation and improve mucus clearance. Gene therapy and stem cell therapy are also being explored as potential future treatments for chronic bronchitis and other COPD conditions. Researchers are also investigating the role of personalized medicine, tailoring treatment based on an individual's genetic makeup and specific disease characteristics.